Hello, I'm Dr. Emily, and today I want to discuss a topic that's both urgent and deeply personal. Imagine this. A small, seemingly harmless pill you take daily could be silently eroding your memory, altering your personality, and accelerating cognitive decline. It's a scenario that's becoming all too common among seniors. Recent studies have uncovered that certain medications, often prescribed for everyday ailments like allergies, anxiety, or insomnia, may significantly increase the risk of dementia. Some of these drugs are so commonplace that they're likely sitting in your medicine cabinet right now. In this video, we'll explore 9 medications linked to rapid cognitive decline. We'll delve into the science behind these findings, share real-life stories, and discuss what you can do to protect yourself and your loved ones. Opioids. The pain relievers with a hidden cost. Opioids are powerful painkillers prescribed for various conditions, from post-surgical pain to chronic ailments. Common opioids include oxycodone, hydrocodone, morphine, and fentanyl. While effective for pain management, long-term use of opioids has been associated with a significant increase in dementia risk. A study published in the Journal of the American Geriatrics Society found that chronic opioid use can accelerate cognitive decline by up to 40%. Good RX. Consider the case of Sheila, a 72-year-old who began taking oxycodone after a knee replacement. Over time, her family noticed changes, confusion, memory lapses, and disorientation. 3 years later, she was diagnosed with early-onset dementia. Opioids affect the brain's reward and memory centers, disrupting white matter that connects different brain regions. This disruption leads to slowed thinking, emotional flatness, and memory gaps. Reflective question. Have you or someone you know experienced cognitive changes while on long-term opioid therapy? Share your experiences in the comments below. 2. Benzodiazepines, the anxiety medications that may cloud your mind. Benzodiazepines, commonly prescribed for anxiety and sleep disorders, include medications like Valium, diazepam, Ativan, lorazepam, Xanax, alprazolam, and Klonopin, clonazepam. These drugs work by suppressing brain activity, providing relief from anxiety, and aiding sleep. However, prolonged use has been linked to a 32% to 80% increased risk of cognitive decline, depending on dosage and duration. Take Walter, a 69-year-old who started taking lorazepam after his wife's passing. Initially, it helped him sleep, but within months he exhibited unusual behaviors, misplacing items, confusion, and memory lapses. 3 years later, he was diagnosed with moderate-stage dementia. Long-term benzodiazepine use can lead to neuron shrinkage, disorientation, and even paranoia. Despite these risks, they are still commonly prescribed to seniors, often without adequate warnings. Do you believe the benefits of benzodiazepines outweigh the potential cognitive risks for seniors? Let's discuss in the comments. 3. Muscle relaxants, easing pain at the brain's expense. Muscle relaxants like cyclopixaprine, Flexeril, methocarbamol, Robaxin, and tizanidine, Xanaflex, are prescribed to alleviate muscle spasms and pain. While they provide relief, a 2020 Mauantuati study linked long-term use of muscle relaxants to a 36% higher risk of dementia. Consider Yvonne, a 73-year-old prescribed cyclobizaprine for chronic neck pain. Her family noticed odd behaviors, pouring milk into a shoe, confusing rooms, and asking nonsensical questions. Eventually, she was diagnosed with early-stage vascular dementia. These medications slow activity in the central nervous system, which, over time, reduces mental alertness. In seniors, this sedation effect is more intense and dangerous, leading to gradual cognitive decline. Have you observed cognitive changes in someone taking muscle relaxants? Share your thoughts below. 4. First-generation antihistamines. Allergy relief with cognitive consequences. First-generation antihistamines such as diphenhydramine, Benadryl, chlorpheniramine, and hydroxyzine are commonly used for allergies and as sleep aids. These medications block acetylcholine, a critical neurotransmitter for memory and learning. Long-term use has been associated with up to a 54% increased risk of dementia. Good RX Franklin, a 71-year-old, began taking an over-the-counter antihistamine nightly to aid sleep. Within a year, he exhibited memory lapses and confusion. 2 years later, he was diagnosed with early signs of Alzheimer's. These medications are still sold freely, often marketed as safe sleep aids or allergy relief. However, for seniors, daily use may contribute to chemically triggered brain decline. Should over-the-counter medications like Benadryl carry stronger warnings for seniors? What are your thoughts? 5. Sleep medications, the quest for rest leading to cognitive decline. Sleep medications including zolpidem, Ambien, azopiclone, Lunesta, and temazepam, Restoril, are prescribed to combat insomnia. While they may provide short-term relief, a 2019 study in the BMJ found that seniors using sleep medications multiple times per week had a significantly higher risk of developing dementia. Judith, 69, started taking zolpidem for insomnia. Soon, her family noticed she was waking up confused and disoriented. By 71, she was diagnosed with mild cognitive impairment. These drugs interfere with slow-wave sleep, crucial for memory consolidation and brain detoxification. Over time, they disrupt brainwave patterns, dulling cognition and accelerating neurodegeneration. Is the short-term benefit of sleep medications worth the potential long-term cognitive risks? Let's discuss. 6. Statins. Cholesterol control at a cognitive cost. Statins such as atorvastatin, Lipitor, and simvastatin, Zocor, are prescribed to lower cholesterol levels. While effective in reducing cardiovascular risk, high-dose statin use has been linked to a 58% higher likelihood of memory impairment in long-term users. Hank, 72, was prescribed high-dose statins after a routine cholesterol check. Soon he began exhibiting confusion and memory lapses. Eventually, he was diagnosed with early-stage dementia. Statins reduce coenzyme Q10, essential for brain cell energy. Some researchers argue that cholesterol plays a vital role in maintaining brain structure and function, and excessively low levels may impair cognitive abilities. Should the potential cognitive risks of statins be more prominently discussed with patients? Share your perspective. 7. Proton pump inhibitors, PPIs. Heartburn relief with brain health implications. PPIs, including omeprazole, Prilosec, and esomeprazole, Nexium, are used to treat acid reflux and heartburn. Long-term use of PPIs has been linked to a 44% higher risk of dementia. Good RX Mabel, 74, took omeprazole for years to manage acid reflux. She began experiencing taste disturbances and confusion, eventually leading to an early dementia diagnosis. PPIs can interfere with the body's ability to absorb vitamin B12, essential for healthy brain function. They also disrupt gut bacteria, affecting memory and inflammation through the gut-brain connection. Are PPIs being overprescribed without adequate consideration of long-term cognitive effects? What do you think? Antipsychotics, managing behavior at the expense of cognition. Continued. Antipsychotics like risperidone, Risperdal, quetiapine, Seroquel, and olanzapine, Zyprexa, are often prescribed to elderly patients for agitation, hallucinations, or aggression, particularly in cases of dementia itself. Now here's the paradox. Medications sometimes used to treat behavioral symptoms of dementia may actually accelerate its progression. In 2021, a systematic review published in the Journal of Clinical Psychiatry found that antipsychotic use in older adults was associated with increased risk of cognitive deterioration, stroke, and even death. These medications work by altering dopamine signaling, crucial for motivation, memory, and mental processing speed. When these signals are blocked, it may cause long-term suppression of neural circuits responsible for cognition and memory. Let me share the story of Doris, an 80-year-old woman who was prescribed quetiapine after showing signs of paranoia and agitation in her assisted living home. Within just months, her memory loss worsened. She stopped recognizing her son, and she became entirely dependent on caregivers. She was once articulate, witty, and deeply social. Now, she struggles to complete sentences. This is where things get controversial. Many caregivers and doctors use antipsychotics because they're told it helps with behavioral management. But are we really helping, or just sedating away the symptoms of an underlying condition, while the root cause worsens? Should antipsychotics be banned for seniors unless absolutely necessary? Or is behavioral management a valid priority in dementia care? I'd love to hear your honest thoughts in the comments. 9. Anticholinergic medications, the silent saboteurs of memory. This category is broad, and frankly, the most alarming. Anticholinergic drugs block acetylcholine, a neurotransmitter that plays a vital role in memory and learning. These include medications used to treat overactive bladder, depression, allergies, and gastrointestinal problems. Common examples: oxybutynin, ditropan, for bladder issues, amitriptyline for depression, and even over-the-counter sleep aids with diphenhydramine. Yes, some of these overlap with categories we've already discussed, but the mechanism here is consistent. Blocking acetylcholine starves the brain of the very chemical it needs to form and store memories. A 2015 study published in JAMA Internal Medicine followed over 3,400 adults for 10 years and found that people taking higher cumulative doses of anticholinergics had a 54% increased risk of developing dementia. Eleanor, 77, had struggled with incontinence for years. Her doctor prescribed oxybutynin to help. It worked, but 6 months later she couldn't remember her neighbor's name or why she'd entered a room. Her family thought it was natural aging, until they realized her cognitive decline was accelerating unnaturally fast. Do you believe doctors should be more transparent about the cognitive risks of bladder or depression medications? Let's open that conversation below. The anticholinergic burden, a cumulative threat. We can't ignore. Here's where it gets even more complex. Many seniors are on multiple medications, and some of these carry anticholinergic properties even in small amounts. The cumulative effect is called anticholinergic burden, and it can quietly devastate brain health over time. Even if each medication alone carries a low risk, the combination can push a vulnerable brain over the edge. Think of it like a dimmer switch. Each new pill turns down the light a little more, until one day, the room is dark. In clinical settings, we now use tools like the Anticholinergic Cognitive Burden (ACB) scale to evaluate a patient's cumulative risk. But here's the frustrating part. Most patients never hear about this. They're not told their bladder pill, their sleep aid, and their allergy medicine are all nibbling away at their memory. Controversial idea. Should pharmacists be required to calculate the anticholinergic burden score for all seniors before dispensing medications? Imagine how many lives we could protect. So what can you do? Safe steps for protecting your brain. Okay, Dr. Emily here again. And now that we've covered these 9 medications and their effects, let's talk about action. Because I never want to leave you in fear, I want to leave you empowered. Here are 5 things you can do starting today. Review your medication list. Print it out. Highlight anything that sounds familiar from this video. If you're unsure, check each drug online or ask your pharmacist directly if it has anticholinergic properties. Talk to your doctor, not confrontationally, but collaboratively. Say, I saw some research that links certain medications to memory loss. Can we review my prescriptions together? A good doctor will appreciate your awareness. Never stop medications abruptly, especially benzodiazepines, antipsychotics, or opioids. Withdrawal can be dangerous. Always taper under medical supervision. Ask about safer alternatives. For sleep, maybe try cognitive behavioral therapy or melatonin. For bladder, pelvic floor therapy. For depression, newer SSRI options or talk therapy. Support your brain through lifestyle. Physical movement, social connection, a whole food diet, and brain exercises are more powerful than most realize. They don't come in pill bottles, but they're the best long-term prescription I can offer. Question for the community. Which of these action steps feels most urgent for you right now? Let's support each other in the comments. You've just taken in a lot of information, some of it sobering, some of it empowering. And I want to leave you with this. Memory loss isn't always inevitable. Some cases are preventable, some are reversible. But only if we're willing to look closely at what's in our hands, our routines, and our medicine cabinets. You are not powerless. You have a voice in your health, and you deserve to understand every substance entering your body, especially when it affects the one thing that makes you you, your mind. So here's your call to action. Share this video with someone you love. Leave a comment below with your questions or experiences. And most importantly, schedule a medication review this month. Because protecting your brain is not just about memory. It's about dignity, independence, and the richness of life you deserve. With warmth and respect, Dr. Emily.